My name's Carmen Di Pasquale. I'm a cardiologist here at Flinders Private Hospital. I'm going to answer some questions that patients frequently ask about their stay in Flinders Private Hospital with a cardiology issue. I hope it's useful to you. A cardiologist is a specialist in internal medicine who's specialised in cardiac and vascular issues. So broadly, cardiologists look after patients who have got cardiac or vascular medical problems. A cardiac surgeon is also a heart specialist, but has been trained in a completely different way ever since internship, so that they are specialised in performing surgery on the heart. The term heart pain might be just a little bit too simple to focus on. Cardiology symptoms come in three types broadly. The first is discomfort in the chest, arm and neck, and that can be all sorts of discomfort, right from rather minor to pain. Patients can also present feeling short of breath and with palpitations. Broadly, that's the symptoms of cardiac problems. Cardiologists broadly treat patients who have got problems with their heart or their vasculature. We divide it into three crude groups. The first is patients who have got plumbing problems, so problems with their arteries, which causes angina and heart attacks, problems with the pump of their heart, which causes shortness of breath, and problems with the electrical activity of the heart, which can cause palpitations or collapse episodes. Finding the right cardiologist is a difficult thing for patients, and my usual advice would be that you should trust your referring doctor, which is generally your general practitioner. They will have experience with different cardiologists, they will have a relationship with cardiologists and trust in them, and they've got your best interests at heart. So I think my fallback position would be follow the lead of your referring doctor. When you visit a cardiologist, the procedure will be much like you've experienced with any other doctor you see for the first time. They will talk to you, we call that taking a history. They'll examine you, especially the heart and the lungs, and then generally there'll be tests performed to look at how your heart's functioning and to try and get to the root of the problem that there is. The initial test that a cardiologist will perform is generally what's called an ECG, which is a simple thing of sticky dots on the chest with wires to look at the electrical activity running through the heart. An ultrasound of the heart, which we call an echocardiogram, which is a very safe, non-invasive test. A stress test is often performed to look for blocked arteries, where we get patients to walk and even run on a treadmill while their heart is monitored. And then there are imaging tests, which can take the form of a CT scan, an MRI scan, or even a coronary angiogram, where we put a catheter into the heart from the wrist and take X-ray pictures of the heart arteries that give blood to the heart to see if there are any blockages. You do not need private health insurance to see a cardiologist. You do, however, need private health insurance to be looked after for an inpatient stay in a private hospital. How long does it take to recover from surgery? I'll split this question up because a lot of patients consider stenting and pacemaker insertion as a form of surgery. So when a patient has a stent put in their heart, they're generally in hospital just for the one night. When patients have a pacemaker inserted, that's a little bit of a bigger procedure, but again, just one night in hospital. They might leave with some tenderness and soreness over their shoulder, or even a bruise, but there's not much more than that. In terms of recovery after cardiac surgery and the experience of cardiac surgery, this is obviously a much bigger operation performed by a cardiac surgeon, and that involves quite a recovery. So patients are generally straight from the operating theatre transferred to the intensive care unit, generally one night in the intensive care unit, and then they come out to the ward where they're managed by the cardiac surgeon and the cardiologist here in the hospital, as well as the physio, the nurses, dietitian, and all the other ancillary medical professionals that are needed after someone has cardiac surgery. Patients begin to mobilise on days 2, 3, and usually people are discharged home or to somewhere where they can have an eye kept on them by a loved one or a rehab hospital after about 5 to 7 days. Generally, we say to patients that you're not back to your best and full activity and back to work for 6 weeks after cardiac surgery. In terms of what questions you should ask your cardiologist, my answer to that is simple. Anything on your mind You should feel very comfortable and you should have a relationship with your cardiologist and indeed your cardiac nurses on the ward in the hospital to ask them whatever's on your mind. There's no question that's too silly or too minor. If it's bothering you as a patient, you should ask your cardiologist, and you should have the relationship with your cardiologist and your cardiac nurses that you feel comfortable doing so. What's unique about Flinders Private Hospital and its people? Well, it's a big heart hospital. It does all forms of cardiology and cardiac surgery. It's co-located with a big public general hospital, which also does all forms of cardiology and cardiac surgery. And the Flinders campus as a whole has always been regarded as a place where all forms of medical staff and nursing staff cooperate and get along well. It's not a place of silos where people only look after their own area. So it gives a holistic care of patients all the way from the very simple cardiology to the most complex of patients. Flinders Private Hospital has all the cardiac facilities that are needed to perform high-level cardiology and cardiac surgery. You're seeing around me a cath lab. Flinders Private Hospital has 3 cath labs, has access to CT of the coronary arteries and the heart itself, cardiac MRI, echocardiography for ultrasounds of the heart, stress testing clinics, and of course an ICU department that has great expertise in looking after critically unwell patients with cardiac problems. Flinders Private Hospital is fortunate in that we have access to cardiac specialists, cardiac surgical specialists, and equipment and technology that is right at the cutting edge of cardiology care. This covers all the main areas of cardiology, such as coronary artery disease with stenting, electrophysiology with electrical procedures on the heart and ablations, devices like pacemakers and stent implantation, cardiac surgery. Flinders Private Hospital also has 4 cardiothoracic surgeons who perform all levels of cardiac surgery here on site, and an intensive care unit that can back up that level of cardiac surgery. Indeed, we have cardiologists, cardiac surgeons and intensive care doctors here who are on guideline committees for recommendations on how to treat all sorts of cardiac conditions that go out nationally. A patient should consider or choose Flinders Private Hospital when they're discussing with their referring doctor and their specialist of where to have their cardiac work done, because of the expertise of the specialists who work on this site, because of the technology and the cutting-edge innovations that are used at Flinders Private Hospital. Thirdly, and very importantly, which is often overlooked by many, it's the team environment looking after you in the hospital in your cardiac admission. And this includes the medical staff with cardiac surgery, cardiology, intensive care. This includes the nursing staff at all levels and the paramedical staff who all will work together to get the best outcome possible for your cardiac admission. Thank you for listening. I hope that you've found this information useful and it's answered some of your questions. Remember, if you have sudden onset or severe cardiac symptoms, to call an ambulance and get attention quickly, and indeed Flinders Private Hospital does have a cardiac emergency centre which is open 24 hours, 7 days a week for just such issues. But prevention's better than cure, so look after yourselves.